What is the key difference between gout and other arthritis? Imagine feeling a sudden, sharp pain in your big toe that hits you out of nowhere. That's often how gout presents. The main difference between gout and other types of arthritis is what causes the joint pain and how it shows up. Gout happens because of high levels of uric acid in the blood. When uric acid becomes too much, it forms tiny crystals that deposit in the joints. These crystals trigger quick, intense inflammation, leading to sudden pain, swelling, and redness. Usually, gout attacks start suddenly and affect just one joint at a time, often the big toe, but it can also hit the knees, ankles, fingers, or wrists. These attacks can be very painful and are often triggered by foods high in purines like red meat, alcohol, or stress. In contrast, other common arthritis types have different causes. For example, rheumatoid arthritis is an autoimmune disease where the immune system mistakenly attacks the joint tissues, leading to inflammation. Osteoarthritis results from wear and tear on the cartilage that cushions the joints, causing gradual pain and stiffness. Psoriatic arthritis is linked to psoriasis, affecting the fingers, toes, and sometimes the spine, often with skin and nail changes. These types tend to cause more persistent, aching pain that develops slowly over time and usually affects multiple joints symmetrically, meaning the same joints on both sides of the body. Another key difference is how the symptoms appear. Gout attacks are sudden and severe, often coming and going in episodes. They usually affect one joint at a time and can be very intense. On the other hand, rheumatoid arthritis causes ongoing, chronic joint pain that worsens gradually, affecting many joints symmetrically. Osteoarthritis pain tends to be worse with activity and improves with rest, mainly affecting weight-bearing joints like hips and knees. Psoriatic arthritis can cause swelling and deformity in the fingers and toes, sometimes with skin symptoms. Systemic effects also differ. Rheumatoid arthritis can involve other parts of the body, like the lungs, eyes, and heart, because it's an autoimmune disease. Gout is mainly localized to the joints, but if uric acid builds up over time, it can cause kidney problems due to uric acid deposits. Treatment approaches vary too. Gout management focuses on lowering uric acid levels through medications and lifestyle changes, such as avoiding foods that trigger attacks. Other arthritis types may require different medications like anti-inflammatory drugs or immunosuppressants, depending on whether the cause is autoimmune or degenerative. Understanding these differences is important because it helps doctors diagnose correctly and choose the right treatment. Gout is a form of inflammatory arthritis caused by uric acid crystals, while other types like rheumatoid arthritis and osteoarthritis have distinct mechanisms and patterns. Proper diagnosis often involves blood tests to measure uric acid, joint fluid analysis to find crystals, and clinical examination. From the perspective of gout, it's clear that gout is unique among arthritis conditions because of its cause, crystal deposits from uric acid, and its sudden, intense attacks. Other arthritis types have different origins, whether autoimmune or degenerative, and tend to cause more gradual, widespread symptoms. Knowing these differences helps ensure you get the right treatment and manage your condition effectively. Always consult a healthcare professional for personalized advice and diagnosis, as each person's experience with arthritis can be different.